Welcome, everyone. Five Wishes and MyDirectives are pleased to present today's Digital Advanced Care Planning Across the Healthcare Continuum webinar. I'm Dave Simonson, the Vice President of Operations here at Five Wishes, and it's my pleasure to host and introduce today's webinar. The webinar is being recorded, so participant audio is muted. If you need technical help, please click the Q&A button on the lower bar of your Zoom screen, describe the issue, and I'll do my best to help. You can also use the Q&A to suggest topics for future webinars. The presentation will last up to 60 minutes, and you're encouraged to ask questions throughout. To ask a question, click that Q&A button on the lower bar of the Zoom screen. Type your question for the presenters. It is now my pleasure to introduce Joanne Eason, President of Five Wishes.
Thanks, Dave. I appreciate everybody joining us today, and we're excited to have another one of our webinars that help inform and hopefully engage you more in the practice of advanced care planning. At Five Wishes, we've been helping people, more than 42 million of them, talk about and document their medical care wishes for over 25 years. As part of our nonprofit mission, we strive to ensure that individuals, their families, their medical care teams have the tools that they need to ensure that the wishes are known and acted upon. Today, it's my pleasure to introduce my co-presenter, my colleague, and most importantly, my friend, Scott Brown. Scott Brown is the founder and CEO of MyDirectives. It's the leading advanced care planning technology company in the country. Welcome, Scott. I'm excited to have a conversation with you today.
Hi, Joanne. Thanks for having me. It's a pleasure to be here.
So we at Five Wishes have been busy over the summer providing educational and informational webinars because you, the people who work in the field, want to learn more, and that's awesome. And so before the presentation today, I peeked at the registration list and noticed that the audience is made up of many different disciplines inside and outside of the healthcare arena. So if you have ideas for topics like Dave had mentioned earlier and want to see us cover them, please submit those ideas in the Q&A section, and we'll be considering them very seriously and get back to you if it's something that we can make sure that we provide additional information on, or we'll actually do another webinar on it. So today's webinar is going to focus on digital advanced care planning, specifically focusing in the healthcare arena. Scott and I will share the value of having these documents digitally accessible, as well as how completing advanced directives digitally can be of real value to the individual, their loved ones, and the clinical team. Dave, can you switch the slide? We will also cover being able to pull metrics easier and faster. With CMS, NCQA, and the Joint Commissions looking at increasing the scope of advanced care planning, they're also requiring more data on these conversations and on completion rates, and likely will be expanding their reporting requirements to include accessibility as well as adherence to patient wishes. So many of you use advanced care planning as a community education tool, specifically hospices, the health systems, and health payers. Digital advanced care planning allows you not only to provide an easy way to document these wishes and that they can be easily amended if needed, but also that there are aspects that allow for uploads during community events and in rural settings. So next slide, please. So why ACP? Well, if you're on this webinar, you already know the value and why it's important. As my colleague Paul Malley always says, the advanced directive is the most likely tool that you're going to have and most available, or the only time really that you're going to be able to put your voice in your medical record. So it's important as clinicians, as individuals, as family members, as caregivers, to make sure that people complete advanced directives, have these conversations, have them noted in their medical charts to make sure that their voice is injected into that medical record. And as part of the medical team, it's helpful to know what matters most to your patients so that you can serve them better and it aligns with their goals of care. And studies have shown that families with access to advanced care planning often experience less distress in the final stages of a loved one's life. They spend less time and money on expensive emergency care. ACP is like a roadmap for your loved ones. It provides guidance for caregivers so that they feel more empowered to make the right decisions in a less stressful manner in what can sometimes feel like a lot of chaos. There's also benefits regarding quality measures and quality outcomes. Advanced care planning can help improve unnecessary emergency room usage and hospitalizations, readmissions, and cost utilization at the end of life. And it helps increase the median length of stay in hospice. So next slide, please. So this chart here that we're looking at is results of palliative care consults. So we know that in palliative care, advanced care planning discussions do take place, but so do goals of care and serious illness discussions. So this kind of incorporates all of these. So results from a 2020 study showed that before a palliative care consult, 83% wanted full code. After they had consults and understood their disease and the trajectory, that number went down quite significantly, almost fourfold. And then we see that across the board with DNRs, as well as comfort-directed care. So people went tenfold increase in wanting comfort-directed care based on these conversations and about advanced care planning and how it can really impact what the patient wants if they're completely brought into the process and educated on it. So, as mentioned earlier, hospices, next slide, please. Health systems and payers work with and utilize advanced care planning in the community. So utilizing these goals of care is really important. And what we're going to do now is Scott's going to take over and really talk about the benefits of digital advanced care planning in that healthcare arena.
Great. Thanks, Joanne. So what are the digital advanced care planning benefits? We're going to talk about some of those today. And we're going to talk about how you measure those and why the digital technology is so important, not only for successfully implementing a program, but also measuring it and trying for constant improvement. So let's get right into it. Dave, go next slide. So we're going to start with one of the most important aspects of advanced care planning, which is making the documents accessible. Only a few years ago, statistics showed that as few as 2% of advanced care planning documents that existed were available whenever and wherever they were needed across the care continuum. And if you can have the best document in the world, if it's not the best advanced care planning document, the best advanced directive, best medical order, portable medical order, if it's not available whenever it's needed, wherever it's needed, which really includes our mobile medical professionals like EMS, our first responders that are in the field. If that document's not available whenever it's needed, you're really not fulfilling your promise to your patients, to your members, to our citizens on advanced care planning. That either their wishes are going to be able to be heard and considered in their care, or that the mobile medical professionals that are treating them, or in emergent care, really anyone across the spectrum, are going to be able to access those documents whenever and wherever they're needed. So digital advanced care planning enables that accessibility, which is critical. If people travel, people aren't stationary, and just because if you're doing advanced care planning in your system or in your facility or in your practice, if those documents aren't available, if that person happens to wind up in another hospital or with some emergency care providers that don't have access to those documents because they're siloed in your system, or if they cross state lines, they should still have access to those documents, which is why you want them in a national registry that can only really be created using technology and not sitting in a file cabinet. So moving on, Dave. What are some of the other benefits of advanced care planning? Yeah, first, if you're doing digital advanced care planning, you can leverage the information that's already available in medical records to lighten the load when you're creating or updating advanced care planning documents and portable medical order forms. Now, on the slide, we talk about clinicians, but it's really everyone involved in the process. So from long-term and post-acute care providers to hospital registration to social workers, case managers, to clinicians. And if you're inside an electronic medical record and you can go back and forth between your other patient or resident information and the information that's in an advanced care planning document or a portable medical form like a PULSE, it lightens the burden for everyone involved. We've already talked about the need for portability and accessibility of the documents. The technology behind digital advanced care planning has other benefits. The technology can be used to verify both the content and the validity of those documents. It can be used to address versioning issues and even provide an audit trail so that you protect patient safety and make sure that there aren't changes made to documents that folks don't know about. It also allows for some data de-identification, some aggregation, and some analytics that can provide important insights into your patient health and value-based payment initiatives. Again, I won't whip the dead horse about making the documents accessible, but it goes without saying that if they're not accessible, and that's one of the major problems with advanced care planning, is that those documents aren't accessible whenever and wherever they're needed seamlessly, securely in the clinical workflows. Digital advanced care planning allows for that. Next slide, please. So I'd be willing to bet everyone on this webinar believes in person-centered care. We all believe that we have a right to have our wishes considered, have our values considered, have them expressed, and have them available to inform care and improve what's being done to us and what isn't, frankly. So the question becomes that, when does that right, when does it stop? Does that right stop because we can't communicate with our care team anymore? Does it, regardless of whether that's for a short-term illness or a long-term crisis, does it stop as we approach the end of life? And maybe we can't communicate because everyone on this webinar at some point will lose the ability to communicate with their care team, maybe for minutes, maybe for hours, maybe for days, weeks, months, years. The reality is that if you're not doing advanced care planning correctly, then your resident in your long-term care, your patients in your healthcare system, or your member if you're a healthcare payer out there, you're not fulfilling your promise to them in advanced care planning. It's not doing them good. It's not doing you good. It's not doing the healthcare system good. So digital advanced care planning, when done correctly, when done right, it keeps the individual at the center of care, and that improves care outcomes for every stakeholder in healthcare. So it enables seamless creation, storage, and real-time sharing of critical information, like who makes healthcare treatment decisions on a patient's behalf when they can. It enhances data security while you're simultaneously improving the accessibility of that data and across multiple care settings, and improving the security of that data, even in transitions of care. So it allows individual goals, preferences, and priorities for care to be considered when developing and implementing care plan, but also in emergent care settings. Again, thinking about our mobile medical professionals out there providing emergency care in the field. And the reality is that if you're doing effective advanced care planning, it results in cost savings. It does that by reducing unnecessary and unwanted interventions, not by the scary, early 2000s specter of care rationing or death panels. I think it was at the beginning of the 2000s. It's simply by doing things that your patients want and not doing things that they don't want. Transporting them from long-term care if they want to be transported, and not transporting them if they don't want to be transported, and keeping them and caring for them in place. Next slide, please. So again, most of us here today believe in giving patients a voice in their care. Advanced care planning is the right thing to do. I'd also be willing to bet that many of the folks on this webinar would probably say that you're already doing advanced care planning, if we asked you to. But the question is, are you doing it right? Are you doing it so that it's effective? Are you doing it well? So I'm going to take you through, I'm going to talk about another benefit of digital advanced care planning, which is the ability to actually measure the advanced care planning you're doing and look for areas of improvement where you can do it better. Next slide. Okay. So you've implemented an advanced care planning program in your care setting. Leadership has bought into it, which is critical. Workflows have been adapted if necessary. Your people have been trained to facilitate advanced care planning conversations, and things are going great, right? How do you know? Which of your folks are tasked with helping patients do advanced care planning, or your members for the healthcare payers out there, are doing that? How much time are they spending? Are they having challenges? What's happening to those documents once they're created? Are they being shared? Are they being looked at? Are they being considered in care plan development? Without using digital technology, you can't know the answer to these questions. We always tell a couple of stories to illustrate this. So imagine you're in a healthcare setting. We'll talk about a specialty group, maybe oncology, and you have provider A, and provider A has a patient panel of 50 patients, 100 patients, and that this provider's team, they all have advanced care planning documents, but that this provider's team hasn't looked at them, hasn't considered them, isn't opening them multiple times. They're not updating them with patients. And you can see all that because you're using digital advanced care planning. Now you have provider B. She also has 50 patients. And because you're using metrics and tracking, you can tell when she and her care team working for these patients is looking at these documents. You can tell how many times they've opened them. You can tell how many times they've shared them. You can tell how many times the patient has updated them. You can tell additional documents that have been created based on those documents. Who do you think is providing better care to those patients? I'd argue that it's provider B. I know that there's some folks here from hospital systems. You discharge your patients to either long-term care or skilled nursing facilities often, right? You have skilled nursing facility A, who when you're discharging patients to them, the chances are 1 in 2, 48% of your high frequency users coming back to your ER again and again and again are from this nursing home. And that they're not doing advanced care planning, or if they are, their documents are sitting in a file cabinet somewhere. Maybe they're given to the patient, maybe they're given to the family, but they're certainly not accessible when you need them. And when EMS needs them, as a result, those patients keep coming back to you. Let's say it's less than every 30 days. How does that affect your CMS reimbursement? You have you have skilled nursing facility number 2, and that they're also doing advanced care planning. They're doing it correctly. Their documents are accessible, and the statistics show that the chances of them sending someone back to you are 1 in 10 in 30 days. So you have one facility that's sending back to you about 50% of the time. You have another one that you're discharging to, and the chances are 1 in 10. Who are you going to discharge your patients to? Who do you think is providing better care, and who is following the wishes of the patient? There's, as Joanne said earlier, there's an opportunity to improve the process, but also to improve the economics around advanced care planning for payers, for providers in every care setting. Next slide. So if you're using technology to enhance your advanced care planning efforts and initiatives, you can provide insights that are critical to the constant improvement of your program, regardless of your care setting. You need to know which of your members and which of your patients are being engaged. How often are they being engaged? Are your individual and collective efforts both efficient and effective? Are you spending the right amount of time doing advanced care planning? Are you getting advanced care planning documents completed? Do you have patients that are declining to participate in advanced care planning? If so, why? Maybe they're what we call the unbefriended. Maybe they don't have anyone to name as a healthcare agent or a proxy to make decisions for them. These conversations can be beneficial and to the care outcomes, to your patients and what you're doing for them. But how do you know to have those conversations if you can't track whether or not they've declined or they've accepted, where they are in the process, where they're having challenges? Digital advanced care planning allows the ability to do all of those things. Next slide. So recall the stories that I told you a couple minutes ago. So you may have folks in your system who are really doing a great job with advanced care planning, while others may need education or additional training. Are you incentivizing your providers to do advanced care planning and create portable medical orders or advanced directives, or are you merely encouraging them to do so? Is it working? What initiatives are working? What aren't? If you're not using technology, it's hard to track those, and it's hard to manage those, and it's hard to improve your process. One more. And finally, digital advanced care planning allows you to track these metrics across your patient population, which is another measure of your program's success. So, are you trying new things from month to month to increase the number of documents that you're doing? What's resulting in increased numbers of advanced care planning documents or portable medical orders or conversations, and what's actually being done in your system. Again, are those documents being shared? Are they being accessed? Are they being reviewed? And are they being taken into consideration for care planning? So the documents you're helping your members or your patients create, you can find out who's doing a good job, who's not, what isn't working. And you can't get any of that from advanced directives or portable medical order forms that are sitting in a shoebox or a file cabinet or a safe deposit box, or being attached to a freezer with a magnet. So digital advanced care planning is what gets you there. It's what gets you the metrics and helps you improve your program. Back to you.
Great, thanks, Scott. So kind of going along what Scott was discussing about digital advance or the metrics part of it, we're working with a hospice right now that has been giving out and doing a lot of educational programs and giving out a lot of 5 wishes. And they weren't able to really understand the value or what the community was getting out of this. So we actually set up a program for them to have a landing page on the MyDirectives site that was customized for them. And so when they're out in the community and doing advanced care planning presentations, or they're working with populations within physician groups, they're actually able to go in and help the patient complete them, or when the patient completes it, have them actually log in, create an account on MyDirectives, and upload their document, be it paper. So that way, there's a metric there saying, we might have had 50 people at a presentation or did 50 facilitations this month, and 50% of them actually completed it and have it logged in and are able to access that. So going along the lines of measurement, a lot of organizations we work with really don't have the resources to have the full-blown Epic integration. But what they do understand is the need to measure this. So they start in baby steps. So custom landing pages and being able to just upload a document to make sure it's accessible to the patient and the providers as one easy way in which to do that. Then it's the next step of developing or integrating clinician-facing tool to help have these conversations, so the clinician can actually either document the discussion on the advanced directive on a digital tool with the patient, or push it over to the patient to have them start it and then review it with them at another opportunity, or fully integrated so that way it's completely available across the health system or health organizational spectrum. So that's just some of the ways in which we can do marketing. Go ahead, Dave, you can flip it. Handle the digital aspect in regard to community outreach and marketing. So, speaking of hospices and health systems and health payers also, they are mandated to do community education through CMS. It's part of the program that they have for the Medicare Advantage programs, as you probably all know. So as part of that community education, it's really great to be able to not only provide information on advanced care planning, help people actually complete these documents, and then be able to, like Scott mentioned, upload and do metrics on that. So, from an individual standpoint, it's very easy. You create accounts on these portals. Everyone, thanks, to technology and our ability to use it every day, it's become much more easy and commonplace for people to log on and create an account, get a password, and access a portal. So individuals can go on, create their own advanced care plan, be it 5 Wishes or any other thing, any one that meets the person's needs. And, at 5 Wishes, we think, yeah, our program's the best, but what is the best is what's for the individual and what helps them make sure that their wishes are known. So whatever it is, they can go in, complete it, upload it, and share it. And so that becomes a very important process in digital advanced care planning, is that you're able to share with your circle, be it your clinician or your family, your healthcare agents. And then from an organizational standpoint, these community events, because organizations are out there having these conversations. I had mentioned that other hospice we're working with, they're starting to do this and seeing increased success in being able to measure the impact that they're having in their community on completed advanced directives. And then from a rural patient perspective, a lot of times there's no cellular or Wi-Fi. You'd have to go in, create a paper document. The clinician provider would go back to the office, make a photocopy, scan it, upload it, and then move on. Well, all of this can be completed digitally on a tablet, and then when the provider gets back into cell or Wi-Fi service, it uploads into the system. So that makes it rural advanced care planning much more doable and easy on the individuals and the clinicians. So one of the most important things that I hope you've been able to capture from this webinar, and that has been conveyed to you, is that it's great to have these conversations. It's better to have them documented, and it's best to have them available and accessible. And the gold standard is to have them honored. And that's what a digital advanced care planning is doing, and working within the healthcare settings to get these integrated within EMRs that everyone's working with. So right now, what we wanted to do was give a lot of time for question and answer, because we figured that there would be a lot. And there are a bunch of questions. So Scott, I know that you were looking at the Q&As. Is there one that hit you specifically that you want to address?
Yeah, I'm just going to go in order. And, and I realized I went through a lot of information very quickly, but again, we did want to give lots of time for the Q&A to get to people's specific concerns about digital advanced care planning. So one of the very first questions is, it says, please review how our hospital's Epic system can easily access 5 Wishes and MyDirectives through our operating system. So documents, again, I go back to accessibility. There are two parts if you want to talk about accessing. There's accessing the ability to create these documents and store them. And then there's the accessibility if you're in an ED, or even if you're in a palliative care or a specialty group within a system. And that goes back to the need to have them in kind of a national registry, like the one that MyDirectives we operate. If you're in an Epic system, and you can query and retrieve documents that are stored in what we call our AD Vault Exchange, whether it's directly by working with us, whether it is indirectly through these things they call health information exchanges or national data exchanges. An example is the Health Exchange. Another one is Oracle Health Commonwealth and Athena Health, and a bunch of folks on that one. So the query retrieve can be done. The document can be shown in the Epic storyboard for those who speak Epic speak, and even looked at in the Advanced Care Planning Navigator. Accessing the tools themselves to create these documents. Again, this isn't. I'm not here to sell MyDirectives. I'm here to talk about advanced care planning and accessibility of the documents. We have tools if you'd like to reach out to us, and we're going to give you information about how to contact us at the end. And these tools can either be accessed as standalone tools, or they can be fully integrated into either Epic, the major EHR platforms, Epic and Cerner, now Oracle Health. And again, going back to my point earlier, when they're integrated that way, what's interesting is you can leverage the information that's already in the EMR, whether it's patient information, whether it is provider information, messages to the entire care team as to the status of documents and even the content of those documents. That's the great part about the integrations. But you don't need to integrate. There are lots of folks on this call who are in post-acute care, who are in long-term care, who are in hospice care, who don't they may be in rural areas, critical access hospitals. They don't have the means necessarily to do these big integrations. You don't have to. You can still do digital advanced care planning without doing an integration into Epic or Cerner or anybody else. So the next one, what is the data that advanced medical directives accurately correlate with patient wishes? It's a complicated question. There's data that shows that it does. There's data that shows that it doesn't. The real question is not does it correlate? The real question, I believe, my personal opinion, is why. And if it doesn't, why? And most often, what we found in 17 years of history is because those wishes can't be found. So they're sitting in a safety deposit box. They're sitting in a lawyer's file cabinet
Also,
where they can't
Scott,
be found.
Also, the patient might not have, they might have completed their advance directive, but never talked to their healthcare agents. And so the
They never
healthcare
had the
agent
conversation.
doesn't feel educated about what the wishes are. So if someone's requesting that no intubation happen, that person might not be equipped to be able to do that. So
Right. No, absolutely. Absolutely. The conversation, for folks that are on this webinar, that's what we do day in and day out. That the conversation is the most important part. It's great, as Joanne said, it's great to have documents. If you have documents, it's critical to have them accessible, especially if they're pulse forms and out of hospital do not resuscitate orders and things like that EMS shows up on the scene and needs access. But having the conversation is the most important part. That's what your medical providers are looking for.
That next question, Scott, someone uses MyDirectives to facilitate their ACP discussions. That's great. Will the product change with the collaboration with 5 Wishes?
The answer is no. The infrastructure is the same. The experience for patients and individuals using MyDirectives who love the intuitive format that we use, the question and answer, the fact that you can name your circle of contacts and you can share these documents and you can decide who has access, who doesn't, who has view only, who just gets a notification. All those things will remain the same. Folks that decide to do a 5 Wishes document, what is for me, and again, I won't speak for Joanne and 5 Wishes. What's great is they've got a document that's considered valid across all 50 United States. How many people sitting on this call are in one state, and they're experts on the validity of all the documents across the United States if they walk into your hospital with that document? 5 Wishes is valid across the United States. And so from a healthcare system standpoint, what we love about it is that you're training for one document, right? You're not training again across 50 documents and 50 state documents, many more forms. So no, the short answer is the experience doesn't change. We have folks that are using 5 Wishes. We have folks that are doing portable medical orders. That doesn't change. It changes from your state form, your state appropriate form, but the process is still the same.
Great. There's a question on would the documents and the information be shared to hospitals or funeral homes or stuff like that versus putting that responsibility on the family? And it really is, because it's digital, it can be queried and retrieved. And Scott, I'll let you get into that a little bit more. But from a funeral home perspective, 5 Wishes really is meant to talk about what end-of-life care looks like and what the wishes are of the person before they're dead. Wish 5 does talk a little bit about, do you want to be buried or cremated? But we do recommend that individuals, if they're talking about their funeral plans, actually have that specifically laid out in a different document, be it pre-plan or talk to their family about what they want prior. Five Wishes just, touches on that subject. So if someone really wants to have something much more built out, they need to work with a funeral home directly.
Yeah,
Did
and
you
as
want to
far
talk
as
about queries?
yeah, sure, yeah, sharing the document that's the beauty of being able to use the technology to query and retrieve a national registry or to push these documents because oftentimes it is the burden is on the patient or the family and we've seen these documents that existed for over 50 years and for a long time you even see this on instructions fill this document out, get it signed, do all these great things, and then make 5 copies and give one to this person, give one to that person, give one to that person. Okay, well, you're the individual who created the documents retired. They got a nice lake house, and and you're out at the lake house, and something happens to mom or dad. Okay, who's going to go? Who's going to go drive 2 hours home to go find a document? Well, if they can even find it. So it's a heavy burden on the individual and on the family members to have to go and send that. It's a lot easier if it's available so that anytime it's needed, regardless of the care setting, you can query and retrieve for it in a secure, real time manner, no delay. That's the digital technology. That's it.
Speaking of secure, someone's asking about confidentiality. And how do you make sure that this information doesn't get into the wrong hands?
So what's interesting is, yeah, that's a great question. We personally, you can't keep an individual from sharing their username and password. So and some people do that, and there's not a lot you can do about it. From a care setting standpoint, again, you go back to digital technology, and you know exactly who's logging into your system. You know where they are. You know what system they're on. You know everything about them. When if you're if you're in an integrated setting, in Epic or Cerner, you've got hospital controls, you've got facility controls, you've got admins, you've got people that define role based access. Again, I'm not here to sell my directives, but we've gone through this thing called high trust certification, which is a third party independent audit for security and privacy. And you want to look for somebody that's done something like that. You can't always control who has access, but using the technology, you can audit it, you can track it. Who's accessing a document and when, and you can collect all kinds of information about that access. And that's the best way, to protect the patient and make sure that there isn't any malicious, interference going on or changes to a document or things like that. Imagine track changes. If you folks out there use Microsoft Word, you can figure out if changes have been made to a document. Well, it turns out you can do that in other ways too. And those are some of the things that we do using the technology to protect the individual.
Great. So Scott, this one's directly aimed at you, and they want to know what's the
Uh-oh.
level of buy-in from hospitals and clinicians to accept MyDirectives electronic communications in their systems, like their EMRs.
What is the level of buy-in? So obviously it depends on the system. Some are very conservative. Some don't feel like they want to share the documents that sit in their file cabinets or siloed in their. Just because you named Epic, I'm not going to use Epic for anything, but sitting in their electronic medical record, they want to keep those for themselves. We receive up to 330,000 queries on our registry every 24 hours. So that tells us that people want these documents. There is buy-in. Some hospital systems believe strongly in advanced care planning, the power of advanced care planning. And without naming them, because I'd like you to go watch other webinars that Joanne and Five Wishes have done. But some of those folks have been on previous webinars and have talked about their success. Others, are still trying to figure out how to work it into their clinical workflows, which could be a challenge. I alluded to it during my comments. You have to get buy-in from your leadership. There are folks that are talking more and more about, and not to go down this rabbit hole, I'm just going to talk about, happy to talk about it offline. But their wrongful life lawsuits are becoming a thing. A long time ago, somebody wouldn't do something for the patient, and that would result in death or horrible harm, and there would be a wrongful death lawsuit or negligence lawsuit. Now, folks are being held accountable because there was a document in place, and either they didn't go look for it, or they looked for it and they found it, but they didn't consider it, and it wasn't taken into account in the care process. So, as a risk management um, as a risk management tool, advanced care planning is becoming important as well. We believe with the 75 million baby boomers, growing older and encountering healthcare problems, that this will become more and more relevant. And so, hopefully, those systems that are still holding out will get on board. But honestly, our buy-in, especially with all the unfortunate things that happened with COVID, has accelerated, and people are getting it more and more.
Right. I think also on a lot of the EMRs, in order to get to an app, they have to leave the system, and it increases the time that they're spending charting or looking for stuff. Recently, there's been a huge interest in the major EMRs to incorporate some of these standalone advanced care planning technology apps within the system itself, so clinicians don't have to jump out.
Right.
That saves time, makes the documents much more available and readily used. So I think we're going to see a big uptick in the use of electronic and digital advanced care planning because of that. And also, it's getting leadership buy-in for that, as to the question, and it's doing baby steps along the way, starting to show metrics, starting to show successes. And once they understand that, yeah, having an advanced directive is a great measure for the ACP team, what really is important and what really needs to happen, I think, is that there needs to be looking at ROI on how does advanced care planning affect readmission rates, and how does it affect ICU stays, and really quantifiable things that actually impact the patient as well as the health organizations financially.
Yep.
So here's another one for you. It's my understanding that EMS are required to use life-sustaining measures until arrival at a hospital, regardless of the DNR. If so, does EMT follow the visual ACP if it appears on their mobile device?
That's an interesting question, and whoever submitted it isn't going to be happy with my response, because the answer is case by case. You don't know, depending on the jurisdiction, what is required and what is allowed and what is not allowed. But there's also a confusion, I believe, in the question, which is a visual ACP versus a DNR. Advanced care planning documents are patient-generated documents. They are the wishes, the goals, the preferences, the priorities of the individual. There were some great studies done by pioneers in the industry that I won't go into and bore everyone with, but their 2008 report to Congress and long before that tried to help people understand that advanced care planning documents are not legally enforceable. They're legally valid. They're legally acknowledged. They're a tool and toolkit for the decision-making process. Portable medical orders like Pulse and do not resuscitate orders and things like that are medical orders. And it is a generalization to say, but it is generally applicable, that emergency responders are more likely to follow a portable medical order, like an out of a hospital do not attempt resuscitation order or a Pulse form, than they are to follow an ACP, an advanced care planning document. Our first responders, their job is to stabilize and transport. But if there are medical orders that say don't transport and don't stabilize, then they get much more coverage than they do with a simple advanced directive, living will, for example. So it's probably not the answer you're looking for, but it's the best we can do.
Someone just asked a general advanced care planning question, and when should we have these conversations with patients? I'm one to say early and often. And I think as soon as you start adulting at 18, when you're going away to college or getting your own job or trade school or whatever it is, um, you no longer, for the most part, in most of the states across the country, you are your own person and you have to make your own decisions. And so, I know when I started my position here, my twins turned 18. They came home for Thanksgiving and we had a conversation about, hey, you need to complete an advance directive, be it just letting me know who your healthcare agent is and what's important to you, what kind of medical treatment you want. And then, people talk about life changes. So when you're married, one of my sons took his 5 wishes on his honeymoon because they thought it was great questions to ask to get to know each other a little bit better, kind of like a table topics. So, you do marriage, you have a death, you have a disease or a chronic illness that happens and that changes along the line. So all along the spectrum from 18 to 118, everyone should be having these conversations and having them with your physician and your family and your loved ones and your healthcare agent, and talk to everybody about it, because that's the only way we're actually going to start normalizing these conversations, is if people start talking about what becomes important to them when they know they're ending near the end of life.
Couldn't have said it better. Couldn't have said it better. No. And what's interesting about the digital technology is that, one of the historical barriers to advanced care planning and creating advanced directives, and I know I've seen the attendee list as well, so I know there are lots of lawyers on the call. I'm a lawyer, so I don't want to offend my brethren. But we wrote these documents, and people don't understand these documents. And 5 Wishes is an extremely approachable, understandable document. But even so, let's imagine that everyone could understand the documents and complete them. One of the historical barriers to the creation is that people felt they had to go to a lawyer to get them created. And once they're created, they thought it was a one and done process. I've got it; it's in the drawer, ready to go. And it's not. Again, research and pioneering writings on this for the last 30 years have shown it needs to be a conversation that starts early. It happens often, and the digital technology allows you to update it as often as you want, and you don't have to spend a dime. So and again, you could also track what those changes are. So people know that on this day, the individual thought they wanted this, and on this day they wanted that, and so why they're getting different treatments. And it's fascinating to see the differences go.
Great. Someone wants to know if POLST or MOLST or the portable medical orders will be integrated into MyDirectives.
The answer for that is they already are. They already are. Yes, they are already integrated. Obviously, these are clinician, POLST and MOLST and do not resuscitate orders and things like that are clinician generated documents. Oftentimes obviously with patients. But no, our platforms already have POLST and MOLST. We allow clinicians in different jurisdictions to create their state appropriate form, as opposed to pushing them down the national POLST model form road. And what's wonderful is, again, not here to sell my directives. That's the last time I say it. We have a great collaboration with the National POLST Collaborative, which is an umbrella organization for the state POLST organizations. And we actually are incorporating their guidance and best practices and tools into those conversations the same way we're working with Joanne and 5 Wishes to do on the 5 Wishes process, so that you can have it goes both ways. You can have the best document in the world. If it's not accessible, it's of limited value. You can have the most accessible document in the world. If it's not a high quality document, it's not very helpful to the folks that are trying to provide care and make decisions. So our goal as a company is to increase the existence of the documents quantitatively, to increase the quality of those documents, and then to make sure that they're accessible. And so, yes, we work with POLST, with 5 Wishes and others, and we can help create those documents.
Great. So there's a question about, there was a reference to Commonwealth. Can you maybe talk about that and how that's used within the MyDirectives setting?
Sure. Folks at Commonwealth are going to love me for this. The Paul Wilder and company, a shout out to you all. There are, not every EHR can talk to every other EHR. And so, but there are data content and data exchange standards that are created by international organizations, like one called Health Level 7 International. And so these data exchange standards exist. And since EHRs don't talk to each other, they've created exchanges. So health information exchanges where the data can go. Think of it as a hub with spokes and lots of ends. And I can't talk to you out here, but we can both talk to this hub and then talk. So the two major ones in the nation are eHealth Exchange and Commonwealth. And the folks, Commonwealth has members that are the electronic health record vendors, which are, just some examples, not all of them. Matrix Care and long-term post-acute care, Oracle Health, Cerner, Athena Health. No, I don't know if Athena Health is. Anyway, there are a bunch of them that you can connect to Commonwealth. There are others that are connected to Health Exchange, and they all exchange data across a network. Think of it, which is called Care Quality. And so, depending on which EHR you use in your facility or your practice or your healthcare system, you have the ability. I think just about everyone has the ability to connect the Health Exchange if they want. The folks that are using certain electronic health record platforms have the opportunity to incorporate, connect via Commonwealth, and all of them can exchange data together and across different platforms.
Great. So there's a couple of good questions here. How does a clinician access the advanced care plan within MyDirectives? So I know that this would go into more of a demo, but if you want to just kind of talk in generalities.
Yeah, so there are different ways. There are different ways to access documents in our system, and some of them are I would call them a push by the MyDirectives individual user. So if you're an individual, you can create a free MyDirectives account. You can create an advanced care planning document or upload one you already have, and then you have a MyCircle where you can include people like your doctor if you want to share your documents with them, or you can either do that on a regular basis so that they've got a link that always gets them the most recent, or if you're going in for an appointment and you want to just share it on a one-time basis, you can actually do that as well. So that's from the consumer side. From the clinician side, there are multiple ways to do it. Whether it's we have, not to get too geeky in the technology speak, we have what we call an API. So it's an application programmer interface. So if you're in one of the big EHRs, even one of the small EHRs, you can connect with it directly. And then every time a patient comes in and you do a search for their prescriptions, their problems, their MRIs, their blood work. It can run the same kind of query on our system seamlessly, securely in the background and surface that document. If you're in a big healthcare system and you're already connected, again, as we said before, to eHealth Exchange, or you're on like Oracle Health and you're connected through Commonwealth, you can do that automatically already. And then your system may already be, remember, 330,000 queries every 24 hours to our system. So you may be doing it, don't even know. It's okay. It's not the best. But again, even if you're not in one of those settings, if you're in a post-acute setting or an ambulatory setting and you don't even want to integrate, then we have opportunities for people to license a tool that we have called MyDirectives for Clinicians. And the very first thing that happens when you log into MyDirectives for Clinicians and you want to help a patient do advanced care planning is you run a query to see if that patient already has something on our system that you would then update. So lots of different ways to do it. And more detail, again, we just need to know your specific circumstances and be happy to help.
Right. There's a couple questions here at the end that want to know about the individual being able to create an account and upload their documents to MyDirectives. It's free. It's easy. They go to mydirectives.com, put in their email address and create a password. and it pretty much walks them through the whole process of creating a document or uploading current existing ones, and allows for them to put in other medical orders.
Yep. Yes, that's all true. You know, I'm not here to sell Five Wishes either, but Five Wishes Digital has had an option for a long time. So if you're a consumer that wants to do a Five Wishes document, you can go to Five Wishes, and you can follow their workflow, and get your Five Wishes digital document. And then what happens is you get sent over to My Directive, where you complete that Five Wishes document, and it's in our system just like every other document. It goes into this national registry, so it can be located and retrieved. And then every time you log into My Directives, you're going to go to your Five Wishes experience, and you'll update your Five Wishes document. You can do it as many times as you want.
Great. And I think this is going to be our last one. So once an advanced directive is completed in the hospital's EMR, will the data points within the document be digitized? For example, intubation, yes or no? Go into the system and generate a pop-up to the attending to stop or warn them of the patient's wish?
That's a great question, man. That gets into a lot of healthcare data informatics. So there are data exchange, data content, and data exchange standards out there. We have led for a long time in the creation of those standards and worked with HL7 and others to do it. So if documents are created, the short answer to your question is yes, they can be exploded. They can be blown up and you know, down to the question and response level. Now, can My Directives as a company can't force the big EHRs to consume that data on a question by question basis. We're working with them. It always helps advance the case if the people that are actually paying them for their EHR platform tell them that they want that functionality. We have great partners. You know, across EHR, we're very good friends, and we've received just tremendous support by the folks at Oracle Health, for example, Cerner, and they're working every day. The advanced care planning documents are a little more complicated because again, they are goals, preferences, and priorities. They are not legally enforceable. They're legally valid, legally acknowledged. They're a toolkit in the decision-making process. As I said before, medical orders are medical orders, and you know, they're I guess they're more, I'm trying to think of the diplomatic word, they're more acceptable to follow in an emergent care setting, for example, because you know it's a medical order. We have the ability to blow those up. You know, if you have a pulse, you know, we have the ability to develop question by question, and you can do those alerts and do those things. We're working with folks at a system level, both Epic and Oracle Health, but also Meditech and others for them to consume that, and that's something we work through every day.
Great. If we did not get to your questions, because we've run out of time here, we will follow up with you individually. And so with that, thank you, Scott. It's been great having this conversation with you. Thank you all for attending. And Dave, I'll turn it over to you.
Thanks, Joanne. Appreciate it. And we'll look forward to getting those other questions and hopefully getting them out to people.
Thanks so much, and thank you all for attending. This presentation was recorded. It will be available to view within 7 business days. You can find it and all of our other recorded webinars by visiting the Five Wishes webinar library at fivewishes.org/webinars. Feel free to share the Five Wishes page link with your teams and with your colleagues. On behalf of all of us at Five Wishes and My Directives, thank you for allowing us to provide you with information and best practices in advanced care planning. Have a wonderful afternoon. Thank you.